very fortunate to have exceptional, very supportive parents who sent my brothers and me to parochial school and also taught us the importance of working hard and obtaining a good education. And my husband Michael and I have instilled the same values in our children. I became interested in being a nurse around the 5th grade. My mother had had a couple of minor operations, and in visiting her at the hospital, I got to know some of the nurses, and it was then that I decided that I wanted to be a nurse. And I've been a nurse for 36 years. This September will make my 30th year of teaching at UTHealth Houston School of Nursing. I became interested in gerontology because I'm very close to my maternal grandmother who lived to be 94 years old. I'm very fond of all the time I spent with her, and I found that I was very interested and loved working with older adults. They have a whole lot to share with the younger generation, many good legacies that they're leaving for their families, and they really love interacting with the younger generation.
Dr. Ross has been a wonderful instructor. She goes above and beyond to help her students, to teach them the material that they need to learn in fun and interesting ways. She actually takes us on field trips so that we learn firsthand knowledge.
Recently, we assisted at the George R. Brown Convention Center after Hurricane Harvey, and that was very rewarding for the students. They actually got a chance to work alongside American Red Cross nurses, something they would have only learned about in textbooks or in lecture.
If I had to describe Dr. Ross in 5 words, it would be involve me and I learn. That's something she's very good at doing with our students. We involve them in the care that they're going to be delivering in the future, caring for the seniors. Innovative things like bringing them into the skills lab, teaching them end of life care, elder abuse, functional impairment, sensory impairment, taking them out in the community where she's built relationships with many clinical partners.
One day in one of the labs, a lady came into class, and she was a resident there at the senior center. And she was having problems with her ankle swelling, and she didn't understand all the medications her provider had given her. Dr. Ross sat down and took her time and explained to this lady what medication she was taking, what signs and symptoms she needed to look for, and she really made a difference in this lady's life. She came back a couple other times weeks later, and you could see that she was happy again. She understood. She didn't feel like she was a bother, where she always felt like she was a bother. Dr. Ross made a difference in this lady's life that this lady will never forget her, nor will the students forget the impact Dr. Ross made on this lady's life. She makes you a better nurse, that she makes you an advocate for your patients.
What motivates me about teaching is the eagerness of the students. Many of the students are second career. They come to us knowing what they want to do. They've made up their mind, and they're very committed, and they want to know and learn all that they can. The other thing is the collegiality of the faculty. We work very well together. We collaborate on projects, whether it's teaching or research. We really motivate each other.
Mary Ellen is a dedicated faculty member, and she also has an active research area on grandparents caring for grandchildren, and so she really is inspiring to students and as well as faculty, and has wonderful stories that she can tell that helps the student understand some of the psychosocial issues that we have with caring for older adults.
I think what motivates Dr. Ross the most is to be able to give back, to be a clinical instructor, to be a friend, to be someone who just really enjoys teaching, helping, providing resources to people that they would never have access to, and teaching others how to do that.
One of the other things I love about nursing is the opportunity to be involved and a member of various nursing organizations. One of the organizations that I'm very active with is the Fort Bend County Black Nurses Association. We do a lot of community service for this organization, and I am chair of the scholarship committee, so I always say I've got the best role in that I'm able to provide the scholarships or at the annual banquet, and these are well-qualified, deserving students from the Houston area.
Mary Ellen, I'd like to congratulate you on winning the Good Samaritan Foundation Excellence in Nursing Award. It's well-deserved.
Thank you for everything you've done for all your students and all your future students, and thank you for guiding us to help take care of patients better.
Thank you, Dr. Ross, for your commitment to mentoring me for over a decade. You have taught me to lead with creativity, passion, taught me how to teach with authenticity, with love, with connection. Thank you so much.